Okay, so I'm Kathy Kellogg. I work on the intake team here at Support Inc. I've been here for close to 5 years now, and I'm also responsible for our marketing needs as well. So I just wanted to thank everyone for logging on here and joining us for this webinar today. We are so excited to re-review our clinical services and go over the things that we provide internally. I wanted to start with some introductions. So we have Chris Sharkey here with us, and we also have Jamie Wetzel Little. So Chris has been in the field for about 5 years now. He has a bachelor's degree in psychology and master's degree in clinical mental health counseling. Mr. Sharkey is a licensed professional counselor, so LPC. And then we also have Jamie Wetzel Little. She has her master's in counseling psychology and has been practicing for 6 years. So basically the point of this webinar today is to go over our clinical services, discuss what makes supporting clinical services unique, talking a little bit about trauma-informed care and whole person-centered approaches, discussing heart rate variability, OT, and then also opening up this discussion for questions afterwards. So with that, I'll go ahead and kick it over to Chris and Jamie.
And yeah, hi everybody, and thanks for that introduction, Kathy. I'll go ahead and share my screen here for our presentation that we have. Okay, hopefully everybody can see that. All right. So yeah, we're going to be talking about the clinical services that we have at Support Inc. today. And overall, at Support Inc., the clinical services that we have, we try to deliver all of our services through a person-centered and trauma-informed approach. And we'll get to a little more info about both of those here in just a second. But we provide clinical assessment work, consultation, individual counseling, as well as group counseling for our clients at Support. Go ahead, Jamie.
Hi, everybody. So just a quick kind of overview of person-centered therapy. The clinical therapeutic approach of person-centered therapy uses a non-authoritative approach that allows clients to take more of a lead in the discussion so that in the process, they will discover their own solutions. The therapist acts as a compassionate facilitator, listening without judgment and acknowledging the client's experience without moving the conversation into another direction. The therapist is there to encourage and support the client and to guide the therapeutic process without interrupting or interfering with the client's process of self-discovery.
So kind of along with that, a way to kind of think about person-centered therapy is the client is truly the expert in this. So the success of person-centered therapy really relies on these three different conditions. The first one being that we have unconditional positive regard for our clients, which means that the therapists must be both empathetic and non-judgmental to convey their feelings of understanding, trust, and confidence that encourage our clients to make their own decisions and choices. So we're not telling people what they should do. It's not so much advice giving, so much as helping someone decide what they would like to do. Empathetic understanding, which means that therapists do their best to completely understand and accept the client's thoughts and feelings. That we're really trying to hope to elicit that in our therapy sessions to really get a good sense of where they're coming from. And then also we need to have congruence in our therapy, which means that as therapists, we try not to carry any air of authority or any type of professional superiority. So once again, getting back to that view that the client is the expert, not us. And really try to help present a true and accessible self that clients can see as honest and transparent. So yeah, just kind of once again getting at that idea that we're really trying to focus on the individual, not coming in with some kind of preconceived notion of what we'll need to do with this client or anything like that, that we're really meeting them where they're at and helping them identify what they would like to work on in therapy.
And I would say that our clinical team is also very focused on being trauma informed. And so we kind of pay attention to what's wrong versus what has happened. And providing trauma informed care means recognizing the pervasiveness of trauma in our world and seeking to be responsive to this unfortunate reality. It means becoming aware of trauma's many personal and societal consequences, anticipating how trauma survivors may respond to our words and our actions, and doing our part to create a world that does not create any further harm or re-trigger anybody. And even more, being trauma informed means helping to create a world that can foster growth, resiliency, and healing as well. So I think we all are pretty confident that the majority of our clients have experienced some kind of trauma. And so we really try to approach all of our clients with this in mind.
So along with that, some kind of key principles of a trauma-informed approach to keep in mind. First one, and it's probably the most important for any therapy setting, is that sense of safety, that our clients need to be able to feel safe, both in individual sessions, group sessions, whichever clinical service they're getting. But really that sense of safety, though, is one of probably the biggest therapeutic tools that we have, is fostering that therapeutic relationship, kind of giving that safe place to discuss whether it's help getting a job or actually processing past trauma. You have to have that safety first and foremost to be able to do that work. And then along with that, that trustworthiness and transparency, that there's no like, oh, we're gonna say we're working on this when we're really working on something else. No, it's all very straightforward and upfront to build that trust and involve our clients in our therapeutic process. Also, peer support is also really important, being able to have those supports in your life, both friendships, caregivers, staff. All of those relationships are important in creating this environment. Collaboration and mutuality, that we're working together, that it's not just one person coming up with a plan and directing everybody what to do. We're all working together. We're taking into account all of our different backgrounds and approaches and really working together to combine those to kind of create the good approach. Another big part with our clients, that empowerment aspect, giving them a voice and a choice in what they're doing. We can have, an IDT meeting or a service plan meeting where everybody says, hey, this client would really benefit from having therapy services. But one of the first things I ask any client that I'm working with for the first time is, how would you like to have your therapy services? Do you want to meet with me? Because you can't really force something on somebody therapeutically. It doesn't tend to work out very well. So always giving that choice, always giving that voice, and really honoring the individual. And then really when looking in someone's background, taking into account any cultural, historical, gender issues, any things like that, really taking into account what someone's experienced and how that's led them to where they are at currently. So really taking that whole person approach, taking into account that their past life experiences are going to affect anything that they're doing now.
So one of the services that the clinical team does provide is an assessment. The assessment units are utilized by the clinician to complete assessments to aid in creating a treatment plan. And the treatment plan is driven by the symptom areas that are highlighted by these assessments, with a therapeutic intervention tailored to that specific client's needs. And these are assessments that are kind of standardized so that they give us concrete information about if a client is struggling with, say, depression, then we know, oh, okay, this is one of their things that are really kind of creating some difficulties in life. And then we can talk to the client and then go from there in terms of what direction do we want to go to help them with their depression.
Yeah. So then clinical consultation is another one of the main services that we provide here at Support. So consultation is utilized by the clinicians to help meet and discuss with members of the client's residential team, which can include their host home provider, family caregiver, case manager, ARC advocates, anybody else who might be involved with the client's care. And really the goal of using consultation is to help support the team in achieving our client's goals. So as clinicians, we'll typically consult as needed to discuss a client's progress on their goals, as well as ways that the team can support the client through the use of specific interventions. So doing, specific trainings on, hey, we're going to be, implementing, this social skills curriculum, here's some ways that, everyone on the team can help support this. When you have a phone call with the client, you can help them work on these skills, or specifically working one-on-one with like a host home provider, working on, like a safety plan or something like that to help support a client in the home, but really just kind of there for any questions and help and support as needed. So definitely there's, scheduled consultation, but that there's definitely just a spur of the moment phone call of, hey, wondering about how to do this, or I had a question about, something I saw today, definitely doing that as well. So yeah, consultation can be used kind of as needed and for kind of lots of different needs.
Another one of our services is the individual counseling. So individual counseling units are utilized by the clinician to meet with a client for regular counseling sessions. Frequency of the sessions is driven by the client's preference, the client's current needs, and can range from weekly to once a month, twice a month, or as needed. Clients can choose to meet our clinicians at one of our offices, in their home, out in the community, at day program, to kind of have those sessions. And during the individual sessions, the clinician will work with the client on current treatment plan goals, such as learning new types of coping skills or social skills. It can also be a time to kind of check in on like current stressors or things that are changing, things that are happening. Because as we all know from the last year and a half, life can get pretty stressful pretty fast and can change really suddenly. So sometimes, we can really kind of help talk through that and just give them a safe space to talk through things that are happening right in the moment as well.
And then another big part of our clinical services at Support, something that we've really kind of increased over the past year or so, are our group counseling services. So group counseling can be used for, group counseling units get used for a wide range of our clinical groups. And these groups are offered both in person at our offices as well as online through Zoom. Group counseling offers our clients the opportunities to engage in positive social interactions and also get to practice and learn new skills while making it a fun environment. Currently, Support has groups on social skills, exercise, relaxation, current events, and more. Like, for example, later today, we have Life Club coming up this afternoon at 12:15. Then we have groups throughout the week, including, I believe Chill Club. We've had Moving and Groovin', Pop Culture Club. We have a gaming group on Tuesday evenings as well. So just kind of all different types of groups. So really, you can pick and choose what you're wanting to attend, but definitely they're all available to anybody at Support. And even host home providers or family caregivers that want to hop on and learn some skills too. You're always welcome. So yeah, lots of different group services that Support. And it's been something that's been, especially through a pandemic, been very nice to have this virtual way to meet with our clients and to give them social opportunities as well. For example, just in one of my groups, a few of the clients all like to play the Nintendo Switch. And we're trying to figure out a way where we can just have like a Nintendo Switch night where everybody who wants to join up and play some Mario Kart or something like that can all play together. So kind of those social opportunities kind of just come up organically throughout those groups, which is really fun to see. So definitely getting to, facilitate groups is something that I really enjoy. And I think it's really one of our just awesome things we have at Support. And then one other kind of unique thing that we have at Support, one of our other clinicians on the team, Faith Wilkins, is an occupational therapist. And I just wanted to give her a quick moment or two here just to kind of talk about how she brings her occupational therapy lens to her clinical work here. So if you want to hop on here, Faith, and take the floor, go ahead.
Hi, everyone. My name is Faith Wilkins. Thanks for the introduction, Chris. I am an occupational therapist. That's a very broad, overarching profession. Let's see. I have some notes here, so I'm just going to kind of read through them. And then, Chris, after this, are we opening up for questions? Or Kathy, what's our next step?
Yeah, we'll be getting to questions here in just a few minutes after you're done, Faith.
Okay.
That's correct.
So I'll try to keep it brief because I'm very passionate about being an OT and I could fill up the rest of our session talking about it. The goal of occupational therapy is to help you do what you need and want to do in everyday life. Occupational therapy is a bit of a confusing phrase because people often just associate me with helping people get employment, which is one factor or one domain in occupational therapy practice, but it really takes a more broad scoping view of what an occupation is. So an occupation is we all have like a million occupations. It's what we do to fill our days. So there are some of those self-cares like showering and getting ready. There's also those next level of paying our bills, managing our time, having social interactions, those leisure skills, sleeping, relationships. All of the things that we do during our day are considered occupations, and we don't really think about them until we have a hard time doing them. So if you go in and you have a knee surgery, all of a sudden it becomes pretty clear, like, oh, putting on a pair of pants is going to be really hard. Like, how do I do this? So there is a practice area of occupational therapy that is in the hospital, helping people to get changed, get their new clothes on, get showered and just rejuvenated for the day and getting their physical health back up to speed. There's also an area of practice that is helping people manage their strong emotions and those sensory experiences and those loud, unpredictable noises. How do we cope with them? Like, it does create a change inside of my skin that feels very uncomfortable. And if we don't explicitly teach how to manage those, then we're kind of missing out on a key piece of a person's calm. And we all know that when we're calm, we're able to think better and more clearly, and we're able to engage in activities that are really meaningful to us. Let me see what else is on my notes. There are some common questions that I like to ask when meeting, or at least I'm thinking about. I have a couple lists and I came up with a client, Joey. So what are some of Joey's most preferred activities? What can we learn from those activities? Does Joey enjoy their routine? Does Joey ask the same questions every day, sometimes over and over again? How does Joey like to learn? Can too many words become overwhelming? I'm going to make a little plug here. There's this concept called motor imitation, and it's teaching someone how to do something with using very few words and just getting them to imitate your body. So if we want to think about like teaching someone how to wash their hands, washing your hands can be an overwhelming sensory experience in itself if like the water is too hot, or maybe they don't like the texture of the soap. And so if we can reduce teaching that skill to just imitating our motor actions, we might get farther than being like, okay, turn on the hot water, now scrub your hands, now flip your hands, now go between your fingers. that just becomes a bit overwhelming. And then one of the last questions I like to think about is how is Joey's stress response impacting their ability to engage in meaningful activities? So going back to that sensory experience where there's a really loud noise, if I get really overwhelmed, even if I'm doing my most favorite thing, if I don't know how to calm myself down, I'm probably going to want to stop doing my most favorite things. I think I'll leave it at that. Yeah.
One thing I wanted to ask Faith, so when it comes to the OT lens that you bring to the team here at Support Inc., what would you say is one of the most common goals that you work on with the individuals that you currently serve?
Their stress response and thinking about how did that feel inside. Sometimes the word of anxiety is a really big mystical thing that just happens to me, but we can really reduce it down to like, no, your heart rate just increased, like, and you flipped your lid. I like to talk about the upstairs brain and the downstairs brain, and the downstairs brain is your survival and your emotional brain. And if that gets too activated, it cuts off the connection to your upstairs brain that is your thinking and problem solving brain.
All right.
Is there anything else to cover on the OT front before we move along to questions?
I don't think so. I'll be happy to answer them if they come up.
Well, yeah, no, thanks for that, Faith. And yeah, so just kind of finishing up, we'll get to questions here in just a second. But yeah, if you are curious about clinical services, you can talk to your case manager or resource coordinator. There's a few different terms that get used at the different agencies, and just request that clinical services be added to the service plan. You can also talk to your RPC at support to help request the clinical units. And if you're like brand new to support or considering using Support Inc. services, you can always talk to your intake coordinator about getting clinical services included in your plan as well. So with all of that, I know we've talked about few different things about our clinical services today. So yeah, really opening the floor to any questions, whether that's about the specific, how, like setting up therapy and scheduling and stuff like that, down to all those details, or just more, therapeutic, settings and things like that you might be curious about. So really, yeah, if anyone wants to submit questions in the chat or just raise your hand, we'll try to get to everybody here as anything.
Sounds good. Yeah, thank you so much, Chris and Jamie and Faith. I feel like that was such great information to have. From the trauma-informed care to explaining all the different services we have, I feel like this was really good information. And for my own selfish purposes, I probably will be joining your Nintendo Switch group in the near future. So
Sounds good.
All right, looks like we have a question from Audrey. Is that the last slide by chance? So I can see everybody's lovely faces again.
Oh yeah, I can get out of presenter view here so everybody can actually see everybody again. Yeah. Let me get out of there.
Such a nice looking PowerPoint.
Now we can actually see everybody again. All right.
Yeah.
So yeah, it looks like we had a couple questions in the chat here. Audrey was wondering if we work with children ages 6 and 7. So unfortunately, we only do get to work with adults right now. The youngest age we work with currently is 18 with our EPSDT funded clients. So once you're kind of transitioning into adult services, that's when supporting can start providing services. But I do believe there are some other kind of state resources for children as well. Okay.
Sounds good. Looks like Christine Barrett said she would like to share something as well. So we're all ears.
Okay. Hi. I'm a family caregiver, and I'm also an occupational therapist. And my son, who's well into adulthood, has Down syndrome, but also a lot of autism. And recently, he just started going through this really personality change and became very aggressive, would have violent episodes. And, you know, I was trying with everything I knew as his mother and as an occupational therapist and everything else, trying to figure out what it was. And I narrowed it down to 2 causes. One of them was constipation, and the other one was, I suspect, sinus congestion would bring this on. And so, as you know, a history, knowing him all his life, he has not had, you know, he would often go a day or 2 without having a bowel movement. And it wasn't anything that was, you know, we worried about. But, you know, then it seemed like, you know, that this was a problem. But still, you know, if he'd have bowel movements on his usual schedule, didn't really think there was a problem until I was talking to my sister-in-law. And I actually, Christian has a diagnosis of dementia on top of, you know, his other, you know, intellectual challenges. And this happens with people with Down syndrome. They seem to be susceptible to Alzheimer's and all of that. And he started this decline, you know, that was apart. And so he has that. So my sister-in-law, her mother lived with my sister-in-law and brother, and had dementia, and went to a doctor who happened to be from India. And he told my sister-in-law something that I have never heard, you know, personally or professionally. And no one that I've ever talked to has ever heard this either. And he said that for people with dementia, it's really important that they clear their bowels daily. And like I said, I'd never heard this, but of course, my son was going through this problem with constipation. So we started just targeting on that. And so it involves, you know, a very multi-pronged approach, which is making sure he gets plenty of hydration, making sure he has a diet, you know, with fiber and everything in it, making sure he gets physical activity, giving him Miralax once a day. And then the one thing that has, you know, all of these things are important, but it seems like that they can't guarantee it. And so the one thing that's been important, and I'm sorry to bring up these kind of indelicate matters, but the thing is using a suppositories daily to make sure he has at least 1 bowel movement a day. And in doing all of that, he usually has, you know, more than 1. But I want to say there's been this complete transformation. He's back to his usual kind of little lamb self, you know, and the typical, yeah, he's been back. And I just wanted to share that because it's something that I've never heard, and yet it's made a huge difference. So that if anyone else, and even for the therapists, the OT, of course, going to the bathroom is a real OT involved, you know, something that they deal with. But just to know that, you know, if there are these sudden personality changes and aggression and all of that, to look at that. So
Yeah,
that's
thanks so much. Yeah, thank you so much for sharing. I definitely know that when it comes to physical discomfort, that does tend to affect our moods and things like that. Faith, is there anything else that you would chime in on that front?
That's where it comes down to just being observant of those things that happen every day, that it's so easy to look over. And if someone doesn't go to the bathroom, it can be so easy to just kind of overlook that. But thanks for reminding us to be mindful of that and just creating those, tidbits of information so we can remember them and reflect on them and pull them out of our pocket when we see those sudden changes.
Definitely. Yeah, thank you.
I see Arlene has a question.
I was gonna say, yeah, go ahead.
Yes, I was wondering is the assessment used to create the IBSSP?
Yeah.
Yep.
Okay, how do I get an IBSSP in place for somebody? I mean, I've been doing like GERs and weekly T-logs, so behaviors are getting to you guys and being reported. But I feel we really need to have an IBSSP in place for one of my family members. So it can be tracked more like on a daily basis. But then I have another family member that we take care of too that already has an IBSSP, and that was created a long time ago and it's very out of date.
That's good to know.
And we need that to be updated.
Okay. And so so I'm clear, Arlene, you're talking about being able to like specifically go into like their app and kind of document each day if you saw a behavior, that kind of tracking.
Right, because like my daughter, I go in there daily and it's very, very long, but it's very outdated. And a lot of things don't pertain anymore. And so that needs to be updated.
Okay.
But then my brother, we've just had him almost a year, and it would be very helpful to have a daily log of things that are issues. So I don't have to be so detailed in my T-logs and weekly.
Yeah, I think Arlene will be able to talk more because I'm seeing one of them in the home. We have our meeting on Monday, and a part of the BISSP process is learning about the person and how they interact with their environment. And so a big part of like, yes, I can just get the assessment results and then I can get you this paperwork, but it's more meaningful as I gather more information. So it does take like up to 10 hours to really be able to put together a quality assessment. So that's one of the cases. And then I think it's talking with your clinician about, these behaviors aren't really relevant anymore and it's time to streamline. Because also we want to make sure your work is meaningful. Like if you're going in every day and you're putting in time and effort, let's find a way to make it more meaningful. Perhaps your other
Right.
clinician is on maternity leave.
Yes, she is. So I'm making myself a note, because when she gets back, I'll talk to her about that. Because I know I had talked to Jesse several times, but we never really, got anywhere with it. And so, I think this is a good question because, things need to be updated. And I do understand your point of view with my brother, because you just started working with him. But, we're also seeing that we need something besides just a weekly T-log.
Yeah. Makes sense.
And then also, I am going to be emailing you either today or tomorrow about, I don't know any other way to like, I'm thinking maybe email will work for us, like maybe giving you kind of a heads up of how the week has gone before Greg's meeting with you weekly, because like he had a great week. I want to let you know that, and I want to let you know what I'm observing about the behaviors.
That context is very helpful.
Okay, so then I'll just be emailing you like, I don't know, like every Tuesday or Wednesday, just a short little email. So I think it
And
will
this
help you
is-
with your meeting.
an there's all these different processes that my brain comes up with that is a little bit out of our system of TheraP, but there is also an opportunity to create a Google form where it just auto populates like questions that we see weekly with this person. And then you can say yes or no. And then there can be a comment box. And you
I
can,
like that.
we can create a QR code and then you can just scan it with your phone. So you can have one in your car or one in your house, wherever, you know, we can put them in multiple places and then you can just scan it and have it available at any time.
I like that idea.
Yeah, and thanks for bringing that up, Arlene, because yeah, there's kind of lots of different ways to kind of think about like tracking someone's progress, whether that's through just, you know, assessment, you know, scores and things like that, as well as, you know, daily or weekly tracking. And yeah, we've kind of gone through some different ways of doing that at support. And yeah, it sounds like having, you know, more item specific tracking might be beneficial for your individuals as on top of the traditional assessment as well. So yeah, no,
Yeah,
good to talk about that. So thank you.
thank you.
Any other questions or things that people would like to share?
I know one thing I'd like to share is just how much fun I have when I pop in on our groups. So I don't get to pop in as often as I would like to, but I have seen glimpses of Moving and Grooving, Life Club. We also have our client council, which has been really neat to watch them put together parties and festivities and things like that. I know we have a gaming club that's really beneficial for individuals as well. So I think the silver lining of the pandemic, just based on what I've observed, is really this explosion of groups that we've had in the last 2 years. So it's been really nice to see people connect virtually and to get to know each other over a screen and to still have that social interaction despite COVID-19 and all of that. So it's been good.
And yeah, just to kind of add on, speaking of groups, that yeah, later this month we do have our holiday party coming up on the 16th. So that Zoom link should have been sent out, but if you do need it, you can probably contact almost anybody at support. We can get you that info if you want to join our Zoom holiday party later this month.
Nancy, did you have a question? You're muted, Nancy.
Let me see if I can get you unmuted.
Nancy,
Oh.
we're not able to hear you.
Now can you hear me?
Yes, thank you.
Okay, sorry. And I'm still not sure where I am with this group, but Chris brought up the Christmas party. So is that through video or is it in person too? Or
It's both.
that's what I thought. I just wanted to confirm that. I just wasn't sure.
Yeah. For people who generally attend our day program, they are welcome to come on site and to do all the activities on site. For those who don't generally attend or who can't make it that day, if they RSVP by this Thursday, then we can get an activity kit out so that they can Zoom in and participate in all the same activities.
I'm sorry, I'm
Through a
missing
Zoom
you.
link.
My
So I'm
brain
going to resend that invite today. Also for everybody I haven't met yet, I'm Gwen Boney. I'm the Associate Director for Day Services. And as long as I'm unmuted and have the mic, and as long as we're on this topic, Arlene, as you were talking about how to kind of work with your behavioral clinician to understand behaviors better and to formulate kind of a plan that works for your household, I was just thinking about one of the things that I find really unique about this clinical group is how collaborative they are with everybody, working with our residential coordinators to help problem solve and to help overcome barriers to getting services in place or getting to the doctor, working directly with host home providers and family caregivers to help understand what different behaviors are trying to communicate and what they mean. And certainly, Christine, your story about dealing with some physical issues certainly brought that to mind. I really want to just give a huge shout out to the clinical team and would love to hear you talk a little bit more about how valuable your presence is at our day site. We have 15 to 20 people who come to our day site every day. They participate in these wonderful groups that we were just talking about. They go on outings, they participate in activities with us, but it's also a place where our clinicians can come and meet with our participants, see them in that setting, get some better insight, but also give our staff really, really excellent training on how to intervene with different things that come up and how to understand things and how to make decisions around them. So I would love to hear you talk just a little bit about your role there.
I think that's a good question. I'm interested. I didn't know what your group was doing. I'm coming together now from some of the emails I've received and haven't had time to read or just glance at. And so I'm not really clear on some of the stuff that's going on. And I feel like support is this little thing and it's bigger than it is, you know, that I think it is. So that's good. Because if I have to, I'm still waking up, so sorry. If something were to happen to me, I would know that he has good people working with him. And I've worked in a clinical setting before through hospitals and through caring for Colin all these years. So it's good to know that people are on track. I know it's not stable right now and a lot of people are leaving their jobs or moving. So hopefully it's, you know, the future people will be as coordinated as you guys seem to be. So, okay, let someone else talk.
Yeah, cool.
Okay.
Well, yeah, no, definitely with that. And yeah, definitely throughout a pandemic, yeah, very tough times to kind of plan things out. And that's, yeah, where thankfully, yeah, the kind of increasing our group offerings and some of our other services through online has been a great way for us to expand through all of this.
Well, the severity of the stress, sorry to Chris, but there are doctors that are quitting. And to me, you work really, really hard to become a doctor, and it takes a lot to leave that position. So that's where we are with this, and it trickles down through all the different channels. And so we gotta stay strong.
Yeah, for sure. One of the benefits that I would say about receiving your residential supports and your behavioral supports all under one roof is going to be the team support and the continuity of care that comes with having everything under one roof. So we connect really well with our day services department, increasing communication with your direct support professional. I know I've seen firsthand clinicians come into day program wanting to check on those individuals, make sure they're okay. If there's any questions that you want to maybe pull them aside privately, talk with them in a safe space. It's really a good environment to do that outside of a host home setting. Maybe if the parent wants someone to check on their child, hey, they were acting a little strange this week, can you maybe just pop in on day services and check in on them? It really creates another atmosphere to increase that communication without it being under their home roof, if that makes sense. So
yeah. And yeah, like, for example, I'll meet with most of my caseloads currently kind of more in our northern region. So I'll meet with clients like at our Loveland office up north. I know Jamie and Faith, both of you have clients that you'll see at either day program or meet them at the office. Anything about that you'd like to share?
Well, I mean, I think it's helpful to have kind of that option to meet your client at day program, and we get to work with not just the host home provider, but also the staff at the day program, and make sure that everybody's kind of on the same page and understanding that particular behavior from the same point of view, as well as making sure that any like planned interventions are consistent between the home and the day program. And that way the client doesn't feel confused because, well, a day program, they do it this way, and at home they do it a different way, but it kind of keeps us all working together. And I know that that also kind of helps the direct support professionals know that they've got other people doing the same thing as they're doing, and they've got places where they can go to ask questions. So I know that I enjoy going into day program too, just because it's fun to go and see everybody and do something fun with the clients at day program. So that part is fun as well.
I'm also
Yeah.
wondering, our supervisor, the person that put this whole team together, is on this call, Kurt Mauer. So I'm wondering if you would speak to kind of the formation of this team and our practice and methodologies and things that, you know, we hold important. And why do we hold those things important?
Sure. Hi, everybody. Thanks, Faith. Yeah, I think putting this group together, just hearing everybody talk, it just makes me really happy to hear Chris, you talk, and Jamie, you talk, and Faith, from your perspective. I was thinking of well, Christine, while you were talking, one of the things that I think was really important about what you said, that I think it bleeds through everything that we do clinically, is thinking about where symptoms happen and what kinds of symptoms happen in the worlds of the individuals that we serve. And this is true for people with intellectual disabilities and people without intellectual disabilities. That's some symptoms happen outside of our skin, and then everybody has access to it, right? We call that behavior, right? It's what we say, it's what we do, and we can all observe that. And many of in my experience, in 20 years now, I'm aging myself a little bit in this field, that's been the focus of so much of the intervention that has happened, is what's going on outside the skin. And so we talk about, it's even in the service plan descriptions for services, right? Behavioral services. So the focus has been on behavior so much. And one of the things that we wanted to shift in putting this group together with Chris as a counselor, Jamie's a counselor, Faith is an occupational therapist, Sarah, who's on the call, is a social worker, Gwen is a social worker, is putting together a group of professionals who know what to do with another collection of symptoms, which is symptoms that happen inside of our skin. And the challenge with those symptoms is that when it happens inside of your skin, only one person has access to it, and that's you. And that's such an important focus of clinical work, is understanding what's going on inside the skin of the person and having methods to measure that, like good assessment. One of the reasons why we picked some of the assessments that we did, and our main assessment is called the Developmental Behavior Checklist. One of the reasons why we picked that assessment is that the questions that it asks and the items that are included on that assessment speak to the total behavioral health of the individual that's being assessed, not just their behavior. Now, behavior is important, right? And we've got to treat behavior. And I mean, I'm a behavior analyst by education and by training, so that's my expertise. But I also understand that what's going on inside the skin is equally as important as what happens outside the skin. And so that's been a major focus of putting this team together and putting our processes together, is that we get a more complete picture of what's going on inside the skin and what's going on outside the skin. And I think that was kind of Christine's point, right? Is that something happening inside of the skin was really causing things that were happening outside of the skin. And so much what we have seen is, with that challenge of accessibility, it leads to different interventions, right? You could easily see an intervention being developed just to manage outbursts, just to manage some kind of challenging behavior, verbal aggression, physical aggression, property destruction. Those are the usual kinds of things that we get referrals for. And without understanding what's going on inside of that person's body and inside of that person's skin, we may develop interventions that aren't complete. So that's our main goal, right? We want to do that. And much of that is done by going in and doing an assessment and making a plan of action, and then always adjusting that plan of action, right? It's an iterative process, basically, that we go through. We gather information, we use that information to develop some kind of a hypothesis or reason why we think this is happening, and then be ready to change after that, because be ready to be wrong, I think, and be able to hone in our intervention so that we're addressing the right thing. So that's kind of how we put this group together and why we have such a diverse group of professionals as a part of our clinical team.
Well, you're not doing all the reporting yourself, are you? I mean, when you go in to assess, is that report from your assessment, or is it also from the caretaker.
The assessment that we picked actually has both methods of data collection that you can get, which is caregiver report and from the client's perspective. So you can ask those questions to either person. And the nice thing about that, it gives you a nice kind of round view of what's happening for that person. So you can do both.
Because I didn't know if I had to do that kind of reporting or not.
Yeah, no, it can be nice sometimes to both, do the assessment with the specific client and then whoever their caregiver is and actually compare those two reports if we're able to. That can be really helpful to see if there's any disconnect there based on what one person's observing, what the other person's experiencing. That can actually be the intervention in and of itself sometimes. It's just kind of helping people understand where the other person's coming from. So that's another kind of area where assessment can be helpful.
Kind of hard to get a report from Colin, though, as you know, Colin.
That's
Got to smile at it, Kristen.
no support for me. That's bad support. That's old.
You don't understand. Don't worry about it. He's
Well, looks like we have just a couple minutes left. So before we wrap up, were there any other questions that anybody had? All right. Well, just wanted to thank you guys so much for joining us. I really enjoyed getting to learn more about our clinical services today. Big thanks to our entire clinical team, Chris, Jamie, Faith, Kurt, everyone here that was able to join us. I greatly appreciate it. If you guys have any other questions, don't hesitate to reach out to us, and we will be sharing this recording online later once we have everything wrapped up with it. So,
Go ahead,
Elaine, do
RV.
you have a question? Sorry. Thank you,
Oh,
Kathy.
I just wanted to say thank you so much. This was very informative. Hope we can do more of these on different subjects and stuff down the road. Really enjoyed it.
yes, thank you so much, and stay tuned for more webinars.
Thank you.